Hi, my name is Eric Kim, and today I'd like to discuss our paper, Seeking Trustworthy Information on COVID-19, a qualitative study with the African American community. This paper was written by me, Jana, and my two advisors, Lionel Robert and Sanyong Park. During the COVID-19 pandemic, the African American community has been known to be disproportionately impacted by the disease. Scholars have pointed towards different reasons for these age-symmetric consequences, such as the higher rate of chronic conditions, structural racism resulting in higher social risks, or mistrust towards the medical system and the government. However, there has been a lack of research on how African Americans search for and use trustworthy information on COVID-19. Because COVID-19 was new and unfamiliar to everyone, it is essential to understand how trustworthy information is searched for and processed. This was especially true for African Americans with chronic conditions because they were at higher risks than others and held inherent medical mistrust. Therefore, we conducted a study to accomplish two following objectives. First, we wanted to examine what challenges the African American population with chronic conditions faced while seeking trustworthy COVID-19 information online. Second, we wanted to investigate the strategies they used to search for and process trustworthy information using technology. In order to meet these objectives, we recruited 18 African Americans with chronic conditions in the Midwest and implemented our study through Zoom. Participants were ages 21 to 63 with mean age 47. They consisted of 16 women and 2 men. With these participants, we conducted semi-structured interviews. We asked them about the types of chronic conditions they have, their challenges of managing those conditions during the pandemic, and their approaches to search for trustworthy COVID-19 information. We identified 3 main findings on their challenges and specific strategies to overcome those challenges. First, participants felt that they were being misled by false or partial information on the internet, especially from social media such as Facebook. This was because they felt social media only reflected subjective views of individuals. In order to overcome this challenge, many participants actively explored a variety of information sources and evaluated their credibility to determine which ones were trustworthy. Second, participants said that the COVID-19 information was detached from participants' health situation or historical context. For instance, they thought the government focused too much on COVID-19 and put less emphasis on chronic conditions. They also had misgivings about the vaccines, which was aggravated by their past history of mistrust. Therefore, they tried to search for first-hand information, especially from those of the same ethnicity. Third, participants felt that they were overwhelmed by the abundant and uncertain information on COVID-19. They were confused because the protocols on how to protect against COVID-19 kept changing. Therefore, they tried to limit the number of sources they used to obtain trustworthy information, such as choosing 1 or 2 sources they found most trustworthy based on their prior experience. Thank you so much for listening, and let me know if you have any questions.